Good day. I am Meryl and B. Lucero, a third-year student nurse from Block 3. Today, I am going to perform two of the most important procedures before entering the operating room. First is the hand washing and the surgical hand scrub, and second is donning of sterile gown and close gloving. For the first procedure, it is a responsibility of the healthcare providers to perform due to the following purposes. First is to reduce the number of microorganisms on the hands. Second, to reduce the risk of transmission of microorganisms to clients. Third, to reduce the risk of cross-contamination among clients. Fourth, to reduce the risk of transmission of infectious organisms to oneself. And lastly, is to remove resident and transient microorganisms. To save time and effort in doing the actual procedure and to increase the nurse's working efficiency, assemble the equipment before anything else. The equipment includes the following: nail cleaner, sterile brush, antimicrobial surgical hand scrub, warm running water from faucet, which can be controlled by the hand, controlled by the elbow, controlled by the knee, and controlled by the foot, or the infrared or automated faucet. And lastly, the disposable or sanitized towel. In preparing for the actual procedure, first is to assess the hands. In assessing, make sure that the nails are kept short. Remove all jewelry. Check the hands for breaks in the skin, such as hangnails or cuts. Put on protective attire such as scrub suit, cap, and mask prior to beginning scrub. Wet hands and apply soap. Upon performing the actual procedure, turn on the water and adjust the flow so that the water is warm. Wet hands thoroughly by holding them under running water, letting it run from the fingertips to the elbows. Apply 2 to 4 ml or 1 tablespoon of liquid soap to the hands, but hold hands higher than the elbows during this hand wash. Thoroughly wash and rinse the hands. Continue this motion for at least 15 seconds. Wash hands using friction on all surfaces. First, rub palms together. Then, hand over hand, washing between the fingers. Finger interlaced, washing between the fingers. Back of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Wash and rub fingertips against the palm of the opposite hand and vice versa. Rub both wrists in a rotating manner. Rinse hand tolerably by letting the water run from fingertips to elbows until the cleaning agent or liquid soap is removed. Ready and open the scrub brush or obtain the brush from dispenser. Then, obtain nail cleaner with hands. Clean beneath and around each fingernail with a nail file or orange stick under running water. Afterwards, drop the nail cleaner in sink when complete. Scrub first one hand as follows. Place all fingers of one hand together and brush across nail tips for 30 strokes. Mentally divide each finger and thumb into 4 planes or sides and scrub each plane or side separately for 5 strokes. There would be a total of 20 strokes for each finger. Remember that you cannot repeat one area after, meaning there is no turning back once finished. Make sure to rub thoroughly for friction. Rub the palm of each hand for 20 strokes using a circular motion. Scrub the back of each hand for 20 strokes using a circular motion. Using the same brush, scrub the other hand using the same technique as described. Scrub first one arm as follows. Mentally divide one arm from wrist down to 2 inches from the elbow into 2 or 3 section segments. Further divide each section or segment of one arm into 4 planes or sides. Beginning with the section or segment nearest your hands, scrub each plane or side with 5 strokes using a circular motion. Using the same brush, scrub the other arm using the same technique as described. After which, discard or drop the brush in the sink. Rinse both hands and arms as follows. Flex your arms and rinse from the fingertips to the elbow in a single smooth motion, allowing water to drip from elbows. Do not move arm back and forth under the water. Avoid splashing water or lather onto the surface of the scrub suit or gown. Always keep hand higher than elbows to prevent water from running back from a non-scrubbed area to a scrubbed area. Release water control and allow the water to drip from elbows for a few seconds before moving away from the scrubbing area. Go to the sterile setup area and dry hands. Walk backward into the operating room while keeping your hands elevated at waist level, with the elbows flexed in front of you but away from your body. Walk to the table containing an unwrapped sterile towel while keeping a slight distance from it. Pick up the sterile towel by its folded edge without dripping water into the sterile field. Allow the towel to unfold without touching anything. Use one end of the towel to dry one hand completely, using a rotating motion and moving from fingers to elbow. Use the other end of the towel to dry the other hand and a forearm in that order. Drop the towel into the designated receptacle. For the second procedure, donning a sterile gown and close gloving are being done due to the following purposes: to enable the nurse to handle or touch sterile objects freely without contaminating them, and to prevent transmission of potentially infective organisms from the nurse's hands to clients at high risk for infection. To save time and effort in doing the actual procedure and to increase the nurse's working efficiency, assemble the equipment before anything else. The equipment includes surgical scrub uniform, cap and mask, pack of sterile gloves of appropriate size, sterile pack containing sterile gown, and a clean, flat, dry surface for opening gown and gloves such as mayo stand. Next step is to don surgical attire and perform hand hygiene or hand antisepsis procedures, which are the same with the previous demonstration. Ensure the sterility of the packages of gloves and gowns. Open sterile gowns and gloves. Put on the sterile gown. Identify the inner surface of the gown and pick up the gown beneath the neckband. Avoid touching the sterile field or the outer surface of the gown. Move away from the table, holding the gown away from body at arm's length.
Allow the gown to unfold from the top down. Do not let the gown touch the floor and avoid dangling the gown against unsterile surfaces. Completing the sterile gowning procedure. Hold the gown just below the neckband near the shoulder. Slide both hands and work the arm's pathway into the sleeves until the fingers are at the end of the cuffs but not through the cuffs. Have a coworker grasp the neckties without touching the outside of the gown and pull the gown upward to cover the neckline of your uniform in front and back. The person tying the gown should take care of touch only the ties and not the front or sides of the gown. Put on the gloves. Open the sterile wrapper containing the sterile gloves. With hands covered by the sterile gown cuffs, open the inner sterile glove package. Put the glove on the non-dominant hand. With the dominant hand, pick up the opposite glove with the thumb and index finger, handling it through the sleeve. Lay the glove on the opposite gown cuff, thumb side down with the glove opening pointed toward the fingers. Use the non-dominant hand to grasp the cuff of the glove through the gown cuff and firmly anchor it. With the dominant hand working through its sleeve, grasp the upper side of the glove's cuff and stretch it over the cuff of the gown. Pull the sleeve up to draw the cuff over the wrist as you extend or push the fingers of the non-dominant hand into the glove's fingers. Put the glove on the dominant hand. Place the fingers of the gloved hand under the cuff of the remaining glove. Place the glove over the cuff of the second sleeve. Extend the fingers into the glove as you pull the glove up over the cuff. Adjust gloves for fit and comfort while maintaining sterility. Maintain sterility. When worn, sterile gown should be considered sterile in front from the waist to the shoulder. The sleeve should be considered sterile from 2 inches above the elbow to the cuff, since the arms of a scrub person must move across a sterile field.